Well, greetings again. This is Dr. White with the American Orthodontic Society, and I want to talk some here for a little while about tongues. I mean, everybody should have a tongue, but I had one patient who had cancer of the tongue, and this whole tongue was removed from this lady, a real fine lady, and she told me that when she was 69, she had beautiful straight teeth, and they took her tongue out, and this was 1971 or something when we started working on her, and her teeth had drifted all different sorts of ways where it didn't have the tongue pushing out on the teeth and the lips and the cheeks holding the teeth in position like that. So let's get idea, and I'm going to get in here and we'll show that. Let me touch this. Now here is the lady, and she was about 71 or 2 at this point, and the tongue is removed, and she has a little scarf around her neck down here that she closes, and she breathes through that point, and she feeds herself, I guess, with liquid food things, because you cannot chew if you don't have a tongue. You don't think about the tongue keeps the food pushed up on the teeth, and you can bite it again and put it over your cheeks, and your cheeks will bring it back up there until you get it chewed up enough to where you can swallow this, and you swallow it with your tongue. Your tongue, and my tongue, I'm talking to you right now, and my tongue is going to certain places to make certain sounds, and you don't even know it is doing it, and you don't even think about it, and yet if something happens, your tongue, you can tell real quick. Like you bite your tongue on one spot, and you mess around, and the next day when it's real sore, you happen to bite it on there again. Your tongue is so, it operates on its own brain, seems to. Your tongue will move away from that spot, and you'll have to talk kind of funny. Your tongue says, "You bit me twice over there, I'm not going over there until that gets feeling better." And that's the way the tongue is. Now the tongue does marvelous things for us, and the tongue is a lot bigger than you think it is. It goes way down your throat. Like in this lady's case, she had her tongue removed. If they had just made some retainers for her teeth before they removed the tongue, that would have been great. Then they could have put these retainers in, and it would have held her teeth in that position after the tongue was gone. But when the tongue's not there, it doesn't push out and hold the teeth out, so the teeth kind of collapsed in. And I will look at this lady's teeth here. Now, the tongue is something that can get you in trouble too. If you live in a country like here in America, we can talk about the president, we can talk about the people in Congress, anybody we want to, we can talk about them. But if you were in Russia, or if you were in some areas, and back when Shakespeare was there, you did not talk about the king. He might chop your head off if you gave him bad information. So Shakespeare put out there, "Give thy thoughts no tongue." In other words, keep your mouth shut. If you were thinking something terrible about a person, don't say a word about it. And that's a pretty good thing to just remember today. Don't give your tongue the thoughts don't let your tongue tell the thoughts that you have sometimes when you frequently you go into a person who is sick, and you don't go in there and say, and the person says, "How am I doing?" You tell him, "Oh, I think you're doing fine." You may be telling a little lie, but you need to keep that person's morale up. So you have to lie sometimes about people, so your tongue tells the lie. The tongue brings it out. Now this lady could not speak because the vocal cords and everything were gone, but she could write you a note. So I guess if she were back in Shakespeare's time, he says, don't write any notes, or don't give your thoughts notes to write. But she could write faster than, and so she would write notes and talk to. Just a charming lady. And let's get over here and look at this. And looking at it from first, I mean, this is after the tongue's removed, and she's got this little deal around here, and she breathes through this opening in that, under that deal there. And I guess she could take food that's already ground up or just liquid, more or less. I don't have a picture looking down her throat, but I remember when I opened my mouth, her mouth, and looked down there, you could see almost to her stomach, they going down there. And when you took an impression, if you just put just what you needed in there to take the impression. You didn't want to spill any, because if you did, she ate it. I mean, it went right down, and you had to be extremely careful, banding the teeth and putting brackets on. Anything you dropped, it was gone, man. I mean, it went right on down in the stomach. Now, so we've got in there and put the braces in and everything, and straighten the teeth back up. And then you look at it. Now here, she smiles, and the muscles are different. It affects it some. Now it looks real good from this side right here. And this is okay, coming underneath there. Now, the tongue wasn't there to keep the teeth outside, so the teeth drifted to the inside. And this is now the lower teeth were lined up, and there's nothing there to keep the teeth lined up in here, the tongue. So these teeth all moved like this. And she said she had beautiful teeth when the tongue was removed. And you can see where these teeth have drifted to. And this is 1985. So we went in and we made impressions, and I bracketed very carefully the teeth and be sure they're tied onto the arch wire. And we went in and straightened the teeth up as best we could, and kept from dropping anything down that went down the throat like that. And so this is the tooth that had moved way back. The tongue wasn't there to push it in place. And you don't think about this when you're eating, but if you had no tongue, you'd bite one time, and what went on the inside just went right on down to your stomach, and you can't chew the stuff up. You couldn't take it in like that. So she had to pump stuff. I guess she just drank liquid material, stuff that's pretty well chewed already, or ground up to take care of it. And so we worked on the teeth and got them lined up pretty good. And we made her retainers for upper and lower retainers that she wore, and she kept those the rest of her life. and she passed away several years ago. Was a very nice, attractive lady, and she could write you a little note, and she could hear you, and she would write you a note and just show it to you. And she had a little pad you could just pull it and just erase it and everything like that. So here are her teeth. We took a Panorex and got them lined up like that. And this is her after we finished, a very nice lady. And I thought about tongues. They do so many things. Now you can actually, we have people that suck that form a vacuum in here. If you suck on a straw in a drink or something, you pull it up there by backing the tongue up. And I saw people's bicuspids and the weaker teeth were just caved in on the sides of their mouth. And I wondered how they got there, because you couldn't do it, muscles to make them do that. But I woke up one night and I had this vacuum in my mouth. And if you have a good seal and you swallow, and you can pull a vacuum, and this will just cause the cheeks to be jammed up against the teeth, and this pressure will move the teeth in if it's done a lot like that. So there's just all sorts of forces that are on the tongue. Now, if you're a mouth breather, this is the main thing you ought to do. You don't want to do. If you breathe through your mouth all the time, you have to put the tongue in the bottom arch. And so this widens the lower arch out, and it doesn't widen the upper arch out. And so the upper arch doesn't develop good, so you have less airway, so that makes it even worse, and you breathe through your mouth more and more, and it doesn't widen the upper arch. And this is things that happen in the mouth simply because we've got allergies and other polyps and deviated septums, and the turbinates may be messed up, with these tonsils and adenoids and things that cause us to have no airway to speak of, and we have to breathe through our mouths, and things go wrong that way. Now, children who are born and grown up would be better if they could nurse till they're about 2.5 or 3 years of age. If they could nurse a lot, sometimes when they'd be nursing and not even getting any milk, anything from it, they just do. But that you cannot breathe through your mouth while you're nursing. You can tell that. And so people have, the child develops a proper airway and everything if they nurse more. And that's the way we tell that. So there's just a lot of things about the tongue. And the people that are smooth, the tongue pushes out, the teeth move out. You have things that happen like that. So just remember, when you're eating, think about your tongue. And it is doing a lot of things while you eat, while you speak. And you can remember what Shakespeare said, give your thoughts no tongue. It's better to keep your mouth shut. Maybe I should practice that more myself. So thank you for watching this, and I hope you will join our group, and we will try to explore and work with you people to help orthodontics all over the world. And I thank you for watching, and I hope you'll join our deal. I want to say goodbye